The CDC holding a Zika summit to prepare health officials in case of a possible outbreak of the virus this summer here in the United States. Scientists believe it's spread by mosquitoes, and the CDC says when the number of the insects increase in the warmer weather, so will the chances of a Zika outbreak. Dr. Jennifer Caudle is here. She's a board-certified family physician and an assistant professor at Rowan University School of Osteopathic Medicine, and she joins us now to weigh in on this important topic. And the key is, when the weather gets warmer, we are going to see a mosquito outbreak, if you will, but will it be the type of mosquito that would spread the Zika virus? That's the concern of the CDC.
That is one of the concerns. And the other concern, I have to say, about this summit that they held, I am so happy to see that this summit was held, because the name of the game here is really getting out in front of Zika. You know, the issue is that we really want to prepare state and local officials, prepare them for the likelihood of mosquito-borne transmission of Zika here on the United States, the continental United States. We haven't had that yet. The cases we have now are from travelers, not locally acquired. So we've got to get out there in front of it. That's what the summit was about. And you're right, coming into mosquito season, that's what we really want to kind of have in the front of our minds.
Yeah, we should point out that the symptoms of the Zika virus are mild in most people. The big concern here is pregnant women getting it, because it can cause problems with their children.
Right, I'm glad that you mentioned that, because right, for most people who get Zika, actually, they may not even know that they're ill with the condition. Okay, it can be like others, fever, muscle aches, joint pains, things like that. But it's pregnant women, as you mentioned, that we're really concerned about. This is what's actually caused the World Health Organization to name this a public health emergency, because we know that pregnant women can transmit the virus to their fetus. We also know there's a link between the Zika virus and microcephaly, or small brains, and of course birth defects and developmental abnormalities. It can be quite devastating, and this is so important.
So tell me, as a doctor, then, what you're preparing for in the event that this does become a problem here, not only in the southeast of the United States, where it's predicted will happen, but also in the northeast and possibly the Midwest as it continues to spread. And we don't know how much of an infestation we may or may not have.
Right. We really don't know. But that's the name of the game in terms of preparedness, right? We're going to prepare for whatever
Which
may
we
happen.
didn't do 15 years ago with West Nile virus.
Well, and we haven't done that with a number of things, which is why this is significant. I'm so glad there's money and effort and energy being put into this, because it's about getting ahead of it. But a couple of things that came out of the summit, which I thought was really interesting. There was really a push for getting mosquito control strategies in place for state and local departments. Think about those strategies, get those in place. Also, communication strategies are going to be very important, making sure that pregnant women and travelers are communicated with. And state and local officials are really going to have to talk to their labs, make sure that labs can test for Zika, get results very quickly. That's all part of some of the phased recommendations that the CDC made yesterday. But I think this is really, we're really heading along the right path.
So specifically, some of the other measures, they were talking about spraying, but not the kind that we have seen in the past, more localized spraying and asking for permission first from homeowners, that kind of thing?
So there was actually mention of different strategies. One of them was sort of this door-to-door strategy. And look, there are many of them. And the CDC was actually very clear to say, look, guys, state and local health officials, these are some recommendations, some guidelines. This is not policy. But really, it laid out a number of different strategies, including possibly going door-to-door to minimize, mosquito transmission of the Zika virus.
What can people, in particular pregnant women, do in preparing for this, to try to combat this, to prevent from being bitten by the mosquito in the first place, or what to do if they should be?
Right. No, I'm so glad that you asked. I'm an osteopathic family physician. I see patients every single day, and I'm telling my pregnant patients, as well as the CDC is saying this and other physicians, if you are pregnant, do not travel to places with active Zika transmission. Just do not do it. That is first and foremost the most important thing. But if you are traveling, I actually am going to Puerto Rico for a conference in the next week, and I'm going out and buying bug spray tomorrow. You really want to make sure that you're using that insect repellent with DEET. You want to avoid standing pools of water.
Now, is DEET safe for pregnant women?
So there's a number of different products that are on the market, and actually the products are really great with being clear about what's safe in pregnancy, which is not, and which is safe for children and which is not. So you want to look at the labels for all of them. Avoid standing pools of water, making sure that you're wearing long sleeve shirts and pants and things like that. But really, avoidance is probably the key. Oh, and don't forget that we do believe that Zika is sexually transmitted. So that means avoiding sexual transmission with the use of condoms or abstaining from sexual activity. For those who it applies to, of course.
Dr. Jennifer Caudle, thank you so much.
Thank you.
Very good information, and information that we can all use.
Absolutely.
Thank you.
All right. Hopefully
Enjoy your trip.